came to Tulsa, one of the primary things that brought me here was this hospital and the specialty in orthopedic care, because you can always be on the cutting edge. And what we were really looking for is what's something we can do to advance the patients to the next level. And cryoneurolysis was something on our radar.
The technical term is called cryoneurolysis. Cryo-freeze neuronerves lysis. We kill the superficial sensory nerves by freezing them. So what I want to do is I want to assess what your pain is in that knee before and after the treatment. Do you think you can step up? How bad was that for you?
That's probably an 8.
An 8 as well. Now let's go ahead and get up here in the bed, and now we're going to go ahead and do the procedure.
There's always new things on the horizon. There's always things to make your patients' lives better and recovery better. 2 years ago, I just kind of ran across iovera and did some research on it. And one of our nurses had mentioned it. So that's how I kind of came across iovera first. Like all things, when you start something new, you're looking to see if, the hype is real. I came to the conclusion that, this is what we needed to kind of do to solve a problem of pain control after surgery.
So what I'm going to do is I'm going to use the ultrasound machine. We're going to find out exactly where all those nerves are. We're going to do some numbing medicine, numb up the skin, we're going to numb up the nerve, and then we'll go in there and we'll freeze that nerve.
We started out wanting to evaluate in a small group of patients. We evaluated those patients for a period of about 2 months and see how they did first. The results kind of spoke for themselves. We saw our patients with iovera, without iovera, in terms of how they were doing and the narcotic usage and where they were at 3 weeks and 6 weeks. It was obvious to us.
The procedure only takes about 20 to 30 minutes to do. There's really no discomfort or pain with the actual treatment, and they get instantaneous results with the treatment.
I've had countless patients come back after the iovera and say, "What'd you do different this time?"
A lot of the patients come in very apprehensive and a little bit skeptic. But what's amazing is when we finish and they first stand up and bear weight and they go, "Is this real?" And the look of astonishment on their face when they realize my pain's gone.
There we are, all done. All right, you ready to stand up?
You think I can?
Let's see. See if you can stand on up there.
I'll be darned.
Way different.
Way different.
Before you were really struggling and you fell back down and you got back up.
But I think I can do it. Look at that.
Look at there. Any pain doing that?
No.
So we went from 8 and now you're pain-free.
I'm 0.
There you go, my friend.
Oh, that's amazing, Doc.
You're very welcome.
I'm not the hugging type of person. If I was, I'd hug you.
For iovera, I'd have patients that come in even at their 2-month post-op appointment, and they're like, "I need more pain medication because it hurts." And then once we implemented the iovera, they come back in at that 3 weeks mark, and I ask them, "Hey, how's your pain?" They're like, "I'm not having any pain. I'm no longer taking my pain medications."
What I've seen with iovera is patients get immediate relief. In the 45 minutes that they're in our clinic, from the time we register them to the time we discharge them, we have taken care of a chronic pain problem, and they are amazed. We give them a piece of their life back.
I'm the type of person, that will do whatever is necessary, to get well. And with the iovera help, it looks like to me that it's going to be an easier process. It's been a blessing to me.
It's like a kid coming down on Christmas morning and seeing their presents for the very first time. They're like totally in disbelief at how much pain is gone because they're so happy because they can't remember the last time they've been without pain.
What was most surprising to me about iovera was the first time I got to watch one, and a patient came in, and we do basically a step test when they walk in. So the patient will step up onto a small stool, and we just rate their pain, 0 to 10. And generally people with end-stage osteoarthritis are going to be pretty high, 8, 9, 10 out of 10 pain. The immediate impact and the immediate pain relief that those patients get after the procedure was quite surprising to me. I think we're going to find that physicians and patients alike are going to be trying to find alternatives to pain medication, and I think iovera is certainly a great alternative for them.
Patients are taking less narcotics, they're having better therapy, better range of motion, better rehab. I mean, I've heard of cryotherapy and I knew that would help, but I didn't realize it would be that instant. I was completely surprised. I mean, it's just become standard of practice, and it's our gold standard that we do with all of our patients.
I get to do this every day. That's what I really like about my job. I get to make people better every day, and chronic pain with iovera can be solved in 45 minutes.
Indication. The iovera system is used to destroy tissue during surgical procedures by applying freezing cold. It can also be used to produce lesions in peripheral nervous tissue by the application of cold to the selected site for the blocking of pain. It is also indicated for the relief of pain and symptoms associated with osteoarthritis of the knee for up to 90 days. The iovera system is not indicated for treatment of central nervous system tissue. The iovera system's 1x90 smart tip configuration, indicating one needle which is 90 millimeters long, can also facilitate target nerve location by conducting electrical nerve stimulation from a separate nerve stimulator. Important safety information. The iovera system should not be used in people with the following conditions: blood that thickens when patient is exposed to cold or cryoglobulinemia, blood appearing in the urine when patient is exposed to the cold or paroxysmal cold hemoglobinuria, skin rash that appears when patient is exposed to the cold or cold urticaria, narrowing of the blood vessels in the hands and feet when patient is exposed to the cold or Raynaud's disease, and open and/or infected wounds at or near the treatment site. Patients being treated with the iovera system, a needle-based therapy, may experience certain reactions, including but not limited to bruising, swelling, inflammation and/or redness, local pain and/or tenderness, and altered feeling at the site of application. Proper use of the device as described in the user guide can help reduce or prevent the following reactions. In the areas where you are treated: damage to the skin from being exposed to cold or heat, darkening or lightening of the skin, and dimples in the skin. Outside the areas where you were treated, muscles may not work or move normally. For more information, visit www.iovera.com.